Have you ever wondered what to do if a small child around you were to start choking, or if a loved one were to stop breathing and fall on the floor? Hi, my name is Stacey, and I'm going to inform you of 3 basic life-saving skills that will help you to know what to do in those situations. For 8 years, I was in the Air Force. I was trained in CPR, and I was also an EMT. I was a medical technician by trade, and that was my job. So I really just want to impart some of this information that I've been trained to help a common person to know what to do in those situations. It can be very scary, but if you have the right tools, it can help save a life. Now, the first sign of a heart attack is the very first basic life-saving skill that I'm going to go over today. There are a few signs and symptoms that a person can exhibit to help indicate that a heart attack is occurring. The person can have nausea and vomiting, sweating, pale skin or pallor, anxiety, like a sense of impending doom, crushing chest pain, and difficulty breathing. Now, the crushing chest pain is the person might say, I feel like someone's sitting on my chest. And the signs and symptoms can present differently in females and males. Sometimes the pain can radiate to different parts of the body, or they may not have any of those signs and symptoms. So, or they may just have 1 or 2. So it's important to listen and to look and really ask a few more questions if you feel something's going on there. Now, just to let you know a little bit about what's going on inside with the heart, if you don't know, the heart is a muscle, and there are a few different blood vessels that feed the heart itself its blood supply. And sometimes those little arteries can get clogged up. And when that happens, it decreases the blood flow and oxygen to the heart itself. So when the heart is not getting enough oxygen, that's what causes that chest pain. And so time really is important with this situation, because if the heart doesn't get enough oxygen, it can die. Parts of the muscle can actually die, and it'll turn like almost blackish blue, and you have problems with that area. So you want to make sure that you call 911 or you get to a hospital right away if you feel like someone's having a heart attack. Now, the second basic life-saving skill that I am going to inform you about today is how to perform CPR. If that person that you feel is having a heart attack, or if someone suddenly just stops breathing in front of you, falls to the ground, you need to start CPR, of cardiopulmonary resuscitation, right away. Now, the very first thing to remember is to call 911. You can either yourself do it or have someone in the crowd or standing by, which is probably the best option for you. Now, the American Heart Association is the one that makes the guidelines for CPR. They did change the rules a few years ago as to the order in which you perform it. It used to be airway, A, B for breathing, and C for circulation, in that order. So you would come upon the person and begin breathing for them first. But studies have shown that there are better outcomes when doing chest compressions first. Now, this is my lovely doll that I brought along to simulate a person and then later a pediatric patient. So, the new guidelines are to do CAB, which stands for circulation first, airway, and breathing. The American Heart Association did extensive research, and the research showed that the patient had enough oxygen in their blood to sustain function. It was a pump problem, so they just needed to have it circulated. So this really is what thwarted the change in the parameters. They did come up, the American Heart Association did come up with a little mnemonic to help with keeping the rhythm for chest compressions when you do perform them. They do call this hands-only CPR, and that's just doing the chest compressions. So your heartbeat and my heartbeat, most adults' heartbeats are about 60 to 100 beats a minute. So this song, Staying Alive by the Bee Gees, is really helpful in keeping the rhythm. So finding the placement on where to do the compressions is easy. You want to locate, so you can expose if you feel like it, but you locate the breastbone and you place this part of the palm of your hand directly on the breastbone. You're going to take your other hand, interlock your fingers, stand directly over, keep your elbows locked, and begin pushing down hard and fast. Now if you can imagine that the chest is this, you want to make sure that you go down about an inch for an adult and half an inch for children. So here you are, about to begin your compressions, and then you need to begin your music. Staying alive, ah, 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 staying alive. So, sounds silly, but it's very helpful and to keep the rhythm for the chest compressions. Now, keep doing this until further medical personnel arrive, and then you want to keep track of how long you've been doing this as well. Now, the second basic life-saving skill that I'm going to inform you about today is how to help someone that is choking. If this does happen to you when you're at a restaurant, or even if you're at a barbecue, anywhere really this could happen, there is a universal sign for choking, which someone's grabbing their neck. It's very scary, and adrenaline starts pumping right away. So you want to remember a few simple steps that can really help save someone's life. If a person is choking, they're going to be coughing a lot, which is the body's natural response to clear the airway. Coughing is good. Don't try to pat him on the back, just let him cough it and see if it will come up. But once that stops is when you need to perform the Heimlich maneuver. The steps for the Heimlich maneuver are as follows. So this is the person that's choking. So you're going, no, this is an adult. So you're going to expose the skin, you're going to locate the belly button. You're going to make a fist. You're going to put that fist right above the belly button and right up under the ribs. You're going to take your other hand around the body and place that over the fist. You're going to begin to move upwards and inwards like a J. And you're going to continue to do that until the object comes out forcefully. Now if this doesn't work and if they pass out, you're going to gently lay them down and you're going to call 911. Have someone else call 911. And then you're going to go into the steps for CPR. So you're going to begin the compression. Now, if this were a pediatric patient, things are going to be a little different. This is an infant. You're going to use your non-dominant hand. I'm right-handed, so I'm going to take my non-dominant hand, support the chin, have the child rest on my forearm, and you're going to begin the back blows with that same part 5 times on the back. And then you're going to support the head, move the child over, and you're going to do abdominal thrusts 5 times. You're going to flip them over, back blows 5 times, and then flip over. The same steps go for a child that's choking. The child becomes unconscious or unresponsive. You're going to lay the child down and begin CPR. Now just to reiterate, if a child or an infant needs CPR, you're going to do a little differently. You're going to use your 2 fingers, and put it on the breastbone, and do half an inch down for the chest compressions. So those are the 3 basic life-saving skills that we've gone over: how to recognize a heart attack, how to perform CPR, and how to help someone who's choking.